This 22nd meeting on hypertension and vascular protection, organized by the European Society of Hypertension, for sure it has been a success. Has been a success because the times are not the best in terms of cooperation, but whatever the case, we had more than 5,000 delegates, and we believe that the sessions has been attended, and then a lot of participants. We receive more abstracts than never before, close to 2,000 abstracts. This is a signal that the field is still alive, and because if we look what is the rate between registered people and number of abstracts, it's a very high rate. Very high rate that I think that there is no other meeting in the field of cardiovascular area that has these rates. Then we are really happy, and this boosts us to go and to follow, pursuing the best in our activities for the following years. Of course, that I think that science is science. Science is giving us a lot of new information about mechanisms, about how to diagnose the patients, how to stratify the risk of the patients, how we can treat, because we are from time to time more tools in our hands. But of course, always we need to take in account when the physician is in the office, have an individual patient in front. This individual patient have several characteristics that never is possible to put in any kind of example of any kind of guideline. In this case, of course, personalized medicine always should be present there. Whatever the case, all the activities of the scientific societies is to provide to the physicians with the most updated information, with the most recent advances, in order that the physician can choose by itself what is the best to the patient they have in front of him. Well, like in whatever the field, the possibilities that you want to have in your hands is as much as possible. In some conditions, like is refractory hypertension, the drugs arrive to a certain level. And of course, that in the last few years have emerged some technologies, are all technologies, but are applied for some new mechanisms or revival of some old mechanisms that at the end seems to be that works. Of course, when one new technology is introduced, we need to be cautious. We need to be what is happening with the results. We need to leave the pass of the time, because, well, short-term results are not the best for the patients. Maybe will be the doctors will be very happy obtaining these kind of results, but at the end, what we want is that the patients have a longer and more longer life and with more quality of life. And for this, of course, we need to be sure that the things that we are doing are reducing morbidity and mortality. Of course, I absolutely agree that what we need to follow and our target will be that all the advances that we can obtain in our fields can be translated in two ways. One way is to the society in improving medical care, improving that those things that we can offer our patients, but also we will try to take advantage of those things that we are doing in order that we can translate to other areas, such as the industry, is some companies that can develop devices. But of course, looking always that these companies can produce the best for the patients, but at the same time, these companies, according to these developments, can give also more funds that for the research from time to time become better and best funded. It's true that the times that the father state was who always pay, but this can no longer be maintained in our times. And of course, I think that research should follow these two ways. One, to translate to the patients directly, and once indirectly to translate to the patients, go into companies in order to get funds to follow research that at the end can improve the outcomes of the patients. I agree with this concept, but I don't like the name of neurologist. I can say physician. And if you go a step further, internal medicine. I am internist, and I think that the internal medicine or even family physicians should have the capacity to integrate information and then to provide and to offer to the patients a more balanced and wide scope assessment of the diseases and also treatments. And of course, these arrive one moment that there are limitations, and then you need to require the help of the specialist doing techniques or more expertise in something. But I am absolutely in agreement that the core of the healthcare should be a generalist, if we admit this word for me.